Hello everyone, I'm Kirti Agrawal and I bring you back one of the new topics of neurology, integrated part of neurology, as going to make the whole series of all the diseases in neurology and the integrated subjects related to it. So today I'm going to start with hydrocephalus and CSF related disorders. In this, I have integrated physiology, anatomy, pediatrics, medicine, and also radiology. So, what is hydrocephalus? Hydrocephalus is a condition in which the CSF volume is more than that the required amount, leading to dilation of the lateral ventricles and also the size of head, that is, your cranium, is going to increase. So, what is the CSF volume? So, CSF volume in adult is 150 ml, while in case of an infant, it is 50 ml. If the volume of CSF increases by 150 or 50 ml in cases of infant, it can lead to formation of hydrocephalus. Now, you can see in the MRI images also, the lateral ventricles are dilated. Now, how is the CSF volume increased? Now, for CSF volume to increase, either the production is too much or the absorption is not the absorption is less, and hence the volume of CSF is increased. So we start with how is the CSF being actually produced, and what is the pathway and how it is going to the subarachnoid space. See, in the picture B, you can see that we have lateral ventricles and third ventricle, we have fourth ventricle. But the production of CSF starts from the choroid plexus. Now, this choroid plexus, the word plexus means there is an whole mixture of all the capillaries, and these capillaries are, as you know, that there are having fenestrations in the capillaries, and this can lead to production of active CSF, and then there will be secretion of the CSF into the third ventricle and lateral ventricles. Basically, all the ventricles are going to form CSF, but mainly from the third ventricle it is being formed, and from the lateral ventricle the CSF will go into third ventricle from the foramen of Monro, and from third ventricle it goes into fourth ventricle by the aqueduct of Sylvius, and from fourth ventricle it goes into the subarachnoid space with two openings, that is your foramen of Lusca and foramen of Megenti. The fourth ventricle is in a form of a diamond, and it has two openings, the foramen of Lusca and Megenti, from where the CSF is going to go into the subarachnoid space. Now, the CSF is going to go into the subarachnoid space, and it goes to all your spinal area, as you know, and then it will go into this the upper part, that is going to be your arachnoid projections. You can also say arachnoid granulations. These are very small granulations where the CSF from the subarachnoid space is going to go into the superior sagittal sinus. Now, the brain is going to have one whole sinus system which drains the CSF as well as the venous return of the brain. So you can see in this image that we have superior sagittal sinus, inferior sagittal sinus, then straight sinus, then there will it will drain into confluence of sinus, and then transverse sinus, sigmoid sinus, and later it is going to go into your superior vena cava, and from superior vena cava it is going to go into your heart. So one point to ponder is what is the site of formation of CSF and what is the site of reabsorption of CSF. I hope you understand, and you can comment it in the comment box. Now, what some very basic points about CSF, that the CSF volume, as I have already told you, and if there is any kind of defect in CSF volume, the rate of production of CSF, the pressure of CSF, this can all lead to hydrocephalus. So the rate of production is about 550 ml per day, and the normal pressure is about 70 to 180 mm of H2. Now, if the pressure, for knowing the pressure of CSF, we usually do the lumbar puncture. When we do a lumbar puncture, we put a needle in the subarachnoid space, and we can count the number of drops in 1 minute. If the number of drops in 1 minute is more than about 6 or 10, then it can lead to increase in the pressure in CSF. We can also see that the glucose level of CSF is going to be one two-third of that of plasma. Now, this is going to give you more logic when we are going to study meningitis, which is going to be my next topic. And there we can use this point to differentiate between bacterial meningitis and viral meningitis. Now, what is a CSF marker? CSF marker is your beta 2 transferrin, which we use to differentiate between CSF rhinorrhea and and sinusitis. So sinusitis will be having mucus, right? But for CSF rhinorrhea, it will be CSF that will be leaking out from the nose. To differentiate between these two, we use beta 2 transferrin to identify it. Now, why does hydrocephalus occur? So, to understand this, we should know the cause, right? What are the causes of hydrocephalus? First is the obstructive, and the other is like non-obstructive. As I have told you, that if the production of CSF is increased, then of course the volume of CSF will be high. So, if there is any kind of defect in the choroid plexus, and the choroid plexus starts to form more amount of CSF, then it can lead to hydrocephalus. And if there is decreased absorption, so absorption is from your subarachnoid space. If there is any kind of defect in the subarachnoid space, then it can lead to hydrocephalus. So I can give you some example, like having meningitis is also a defect of subarachnoid space, or you can say if there is bleeding and there is blood accumulated in CSF, then it can lead to decreased absorption of CSF. The obstructive causes are your obstructive means like the pathway which we have understood, right? The presence of lateral ventricles, the third ventricle, fourth ventricle, and then all the foramens and connections between all those. If there is a defect in this particular path, then it can lead to like if there is obstruction in this particular part, then it can lead to hydrocephalus, right? The CSF is going to get accumulated in the previous part, and there will be dilations. Now, there are four major obstructive causes. First is your aqueductal stenosis. Then we have Dandy-Walker syndrome. We have Arnold-Chiari malformation and vein of Galen malformation. Vein of Galen malformation, I will be dealing it later. So, for the others, like what is aqueductal stenosis? See, the word aqueduct itself, in the whole path, we can see the presence of aqueduct of Sylvius. That is a connection point between the third ventricle and the fourth ventricle. And stenosis means constriction, right? So, if there is a constriction in the aqueduct of Sylvius, then definitely there will be dilation of third ventricle, which is the upper part of it. And from foramen of Monro, the CSF can also go into the lateral ventricles, and this whole lateral ventricles and third ventricles are going to get dilated. So this condition is usually in cases of fetus, and hence we are going to use a screening method, that is USG. The second reason is Dandy-Walker syndrome. Dandy-Walker syndrome is because of the obstruction in the foramen of Lusca and foramen of Magendie. And these two foramens are being present in the fourth ventricle. Now, fourth ventricle is in a form of a diamond. It has two openings, and behind the fourth ventricle we have cerebellum. Now, if there is obstruction in these two openings, the whole CSF will be accumulated in the fourth ventricle, and it will also go into that cerebellum area. And now in this MRI, you can clearly see the area where the cerebellum should be present. It is whole covered with CSF. Now, as I have told you, if there is going to be fluid accumulated in some area, and then we can call it as a cyst. So it will look like a cystic expansion. And this is usually the dilation of the fourth ventricle, which is leading to this formation, this covering of the cerebellum. Now, the next region for hydrocephalus is Arnold-Chiari malformation. Now, Arnold-Chiari malformation I have already been explained in neurotube defects in much more detail, but I'll tell you some points about it, like why it is leading to hydrocephalus. In Arnold-Chiari malformation, we have two types, type 1 and type 2. In type 1, usually it does not lead to hydrocephalus, but type 2 can lead to hydrocephalus. So the cerebellum is going to have the vernix and the tonsils, right? If they are going to get herniated, it can lead to closing of the foramen, and hence the CSF is going to start accumulate in the upper region, and we can lead to hydrocephalus. Now, how are you going to detect that if someone is going to have hydrocephalus, especially these conditions like Arnold-Chiari, Dandy-Walker's, and aqueductal stenosis? And for this, we are usually going to do ultrasound of the anterior frontale. So this is not going to give you a accurate diagnosis, but it can give you a certain idea, because in ultrasonograph we are just covering a small area, so you cannot give 100% diagnosis on it, and hence it is a screening test. In as you know, a fetus will be having anterior frontale and the other will be the posterior frontale. So anterior frontale is the one which will be in a diamond form, while the posterior frontale will be in a triangle form. So it is easy to check in the anterior region, right? The bigger the space, the more you can see easily. Now those who don't know what is frontale, these are like connection, whenever the skull of a fetus is being formed, we have sutures between the parietal bone, the temporal bone, the frontal bone, and all these are going to have sutures. So these sutures will have some spaces between them, and these spaces are the anterior frontale and the posterior frontale. Now, to make a confirmed diagnosis, we are going to do MRI of the brain, because in MRI you can see the complete image of all of both the lateral ventricles, and hence this will be our gold standard to diagnose hydrocephalus. Now, you would have heard about normal pressure hydrocephalus, and this is usually in adults, in older adults. The reason we don't know, and hence we called it as an idiopathic condition, and the CSF pressure is elevated but episodically. It's not always high, and hence we name it as a normal pressure hydrocephalus. It does not lead to increase in the subarachnoid space volume. Uh, and because of the dilation of the lateral ventricles, the corona radiata that is going to be present beside it gets compressed, and it can lead to certain symptoms that we usually have a rhyme for it, that is wobbly, wacky, and wet. Now this is really important, because there can be questions which are asked on this, that is what is normal pressure hydrocephalus, and they can give you these three triad for normal pressure hydrocephalus. The first is gait, that will be a magnetic foot type of gait. In magnetic foot type of gait, if the patient is walking, the foot of the patient will be there, but they won't be able to lift that up. If it is going to lift it up, and it feels like it's a magnet, and they are not able to pick their foot up. The second will be your urinary incontinence, and the third is the subcortical type of dementia. Now, this is a question for you. What are the treatable causes of dementia? If anyone would have studied psychiatry, then you would have known that what are the treatable causes of dementia. And please do comment me and let me know what you are thinking about it. So, what are the clinical features? Now, this kind, like hydrocephalus, is like the clinical manifestations will be same for all the different types of the causes of hydrocephalus. So the first one is like microcephaly. Macrocephaly is, macro means, the word means macro means the size of the brain is going to be more. Now, if the head circumference is more than +2 standard deviation, then we call it to be macrocephaly. This will be one of your clinical feature. The other is going to be because of the increase in the intracranial tension, you can the anterior, the front, the whole area of the skull will be expanded. You can see it in that way, and the skull sutures are also going to be separated widely. Now, because of it, the veins and the vessels over here are also going to get expanded, and you can see a dilated scalp veins in the front part of the head. Also, because of increase, you can see the bulging frontale, which we are going to use it for diagnosing, or you can say a screening for hydrocephalus. The other is going to be your sunset sign. Now, in sunset sign, as the sun is going to, like we usually say sunset, right? So when we see a sunset, the sun is going to be here and the other parts appear white, right? Similarly, in cases of this condition, the eyes of the fetus will be like this. The eye part will be down, and the eyeball part, that is the black part of the eyes, will be down, and the whole white part, that is your sclera, will be seen up. In this image you can clearly see the downward gaze of the eye. This is why we call it as to be sunset sign. These are the clinical features that you can see in case of hydrocephalus. So, in order to tell you that how are we going to treat hydrocephalus, it's just like if the CSF volume is very high, we know like we can either drain the CSF by doing surgical management, and we can directly put a shunt into a ventricle and drain it into the peritoneum, and drain whatever extra CSF is there. But if this hydrocephalus is not so prominent, we can just give diuretics and treat these kind of patients. I thank you so much for watching this video, and I request you to answer to the question, what are the causes of dementia, other causes of treatable forms of dementia. One of them is normal pressure hydrocephalus, and you can tell me the other causes. I request you to also tell me that are you liking these kinds of video of integrated topics, and if there is some topic which you would like to understand, then please do tell me. And stay tuned for my next video, which will be on meningitis, that is another CSF related disorder. Thank you so much.